Thank you. And thank you all for coming today. As Jasmine said, I'm Patty, this is Pam. We teach the Healthier Living class. And this class, I would like to tell you all, and there's two of you in here who've already taken it, is a 6-week course for people with chronic diseases or for people who are caregivers for someone with a chronic disease. Chronic diseases are listed as heart disease, arthritis, diabetes, depression, asthma, bronchitis, emphysema, and neurological diseases. At Cleveland Clinic, we consider caregiving also to be a chronic disease. The class meets once a week for 6 weeks for 2.5 hours. It is free, and it comes with a great reference book that we have some here at the end of the class. We will let you peruse through them if you need to. Now, the curriculum was written by Stanford University School of Medicine. It was brought to us courtesy of Dignity Health and St. Rose de Lima. The program was developed over many years by Stanford and is now taught in all 50 states and some foreign countries. Cleveland Clinic saw the potential of the class immediately for our patients and their loved ones. Pam and I were selected to enroll in the class and take the training and the different seminars that we have. We have been teaching the class for 4 years now. This is our 5th year. And we think we make a pretty good team because I used to be a school teacher and Pam used to be a caregiver. So we pretty much know how to work well together. Now, there are many pluses in taking the class, and the biggest one is interacting with people who have similar problems as you do or a loved one does. We found the class to be very instrumental to students in developing lifelong friendships, and we are fortunate to have witnessed several such success stories. One of the stories I always like to tell happened 3 years ago when a couple came to our class. They were both retired. He had Parkinson's. He was on a walker. They sat down in our class and they listened the whole class period. At the end of the class, Pam and I talk about creating an action plan, which is another big part of the program. And we gave examples of the action plan. And as we went around to ask the students, what are you going to do this coming week? What are you going to do this coming week? We got to this couple. And she said, I don't have an action plan. I don't want an action plan, so don't bother me. Well, her husband, who had the Parkinson's, sat next to her, and he said, well, I have an action plan. So he gave his action plan of what he was going to try to accomplish the following week. Well, as we normally do, on Tuesday, we divide up the people who are in our class, and we call to see how they're getting along with their plans. Do they need any help? Do they have any questions? And their name was on my list, and I thought, well, I at least have to talk to him. So I called, and she answered. And she said, oh, I know who you are. And I said I didn't have a plan. I don't want one, and don't call me again. Slammed down the phone. Oh boy, I messed that one up, is what I thought. So when we came to class on Friday, I said to Pam, well, they won't be here because I just offended them by calling. Well, do you know what? They came. And she sat down with him, and we always began the class with, how did you do this week with an action plan? And I skipped over them. And she went, you skipped me. And I said, well, I'm assuming you didn't have one. She said, well, when you called, I didn't have one. And after you called me, I started crying and crying and crying. She said, not only am I a caregiver for my husband who has Parkinson's, my mother lives with us who has Alzheimer's. And she said, I have not had time the last 3 years for myself. And I sat there after I cried and cried, and I said, what would I like to do? And she said, I would like to take a bath, a bubble bath, rather than just jump in the shower and jump right out. She said, I did that with my mother pounding on the door. I took my bubble bath, and I'm going to take one every week during this class. And so, of course, we all were like in tears, because you know what? Having 2 problems in the household and 1 person taking care is a huge, huge burden. So that's just one example of what we encounter in the class. Of course, nobody wants to have a long-term illness, but the cold, hard facts are most of us will either experience 1 or 2 of these conditions during their lifetime, or they will take care of someone who does. The key to successfully coping with life with a chronic disease is to work to overcoming the physical difficulties and the mental and the emotional difficulties. What are these difficulties that we encounter? Well, body control, fine motor skills, and difficult emotions that we have to deal with because life has changed. So it can be a challenge to learn to function at our best regardless of life's difficulties. A life-changing event can occur instantly, and I have another story to tell you. We had a gentleman come to class with his wife, and he was in a wheelchair, electric wheelchair. He was paralyzed from the neck down. We asked what happened. He was a retired principal. They came out to Las Vegas to see their daughter get married. They were in a hotel room. He got up in the middle of the night to go to the bathroom, as is perfectly normal. He fell. Just the way he fell, the angle he fell, paralyzed for life. That's how quickly life can change. And his wife would say to us, my life just changed overnight. And he's probably adapting better than I am. So those are some of the things that happen, but they happen. We have to deal with them. So we want you to learn new ways to achieve the things you want to do, and we still want you to get some pleasure from life. So we want you to become self-managers of your life. And in this day and age, one doesn't need to spend half of their time at the doctor's office. That's not pleasant. So we will show you techniques to help you and your loved ones live a happier, healthier life. Remember, you are the only person who lives your health problems every minute of every day. So it's your choice. You can choose to be positive and learn new methods and new techniques, or you can crawl under a rug and do nothing. Pam and I hope you choose to develop a positive outlook, and we will certainly do our best to help you do that. Pam is going to talk about caregiving.
In order to be a facilitator for the Healthier Living class, part of Stanford's criteria is that the people that facilitate must either have been a caregiver or have a chronic condition. I myself have the dubious distinction of both, but I want to talk to you for just a few minutes about caregiving, because we feel that this class is extremely valuable for caregivers as well as people with chronic conditions. And I was a caregiver. I'll just tell you briefly a little bit of my story. The second time around, I was married to a wonderful man who I loved very much. I was his wife for 10 years, and for 7 of those years, I was also his caregiver. I never really thought that at age 54, caregiving would become my primary role in life. We lived very far from home and family. I had no knowledge of where to turn to for help, and I had no inherent skills as a caregiver. All eyes were focused on Ron, my husband, who was the patient, as they should have been, but that left me alone, ill-equipped and ill-informed. So that's why I'm so strongly believe that this class is a wonderful value for those of you who may be caring for someone. I am a firm believer in what Patty said, that caregiving falls into the category of a chronic condition. You may not have the actual disease, but a catastrophic illness or injury affects the entire family, especially those who are in charge of the loved one's care. Our class is a self-management workshop. We don't talk at you and lecture you. We teach you to become self-managers and manage your life better. You learn to make healthy choices for yourself, whether they're dietary choices, they're physical choices, they're emotional choices, they're mental choices. And we always do everything in small, gradual steps so that your life becomes easier, better, and less stressful, whether you're the one that's diagnosed with the chronic condition or whether you're caring for your loved one who has the condition. It's very, very difficult to be a caregiver and know how to take care of yourself at the same time. To realize your own importance when all eyes are looking at the person who is sick. And often you feel very guilty about how you're feeling. And you're embarrassed by the thoughts that you have. And you feel like you should focus on the loved one who's sick, and so you put yourself aside. Yet without learning the skills that are necessary to care for yourself, you just can't provide adequate care to your loved one. The diagnosis of a chronic illness takes away our sense of security. It takes away our sense of control. And most of us like to be secure. We like to feel like we're in control. But living with uncertainty is very terrifying for everyone who's involved. We will help you to be able to make better decisions for yourself and your loved one in these very trying, uncertain times. And our program includes all kinds of tools. We call them tools. And they will teach you how to have better communication skills, how to deal with difficult emotions. Those are 2 topics we're going to talk about today. How to eat better, find an exercise program that works for you, learn to deal more effectively with your healthcare providers, and work hand in hand with the mind-body connection in order to be more peaceful in your own skin. Living with a chronic disease means that our health train, so to speak, is off the track. It's been sidetracked. John Lennon said it best. He said, life is what happens while you're making other plans. So the class shows you the many ways in which to get the train back on track. Now, it might not be going the route that you thought it would go, but it's going to be a much easier, more manageable track if you learn the skills. And Patty is going to talk about one of them now. We're going to talk about dealing with difficult emotions, which is a very big part of our class.
You have been given, you hear me now? Okay. You have been given a sheet that was on your chair, and it looks like this. And it is a weekly overview of what we go over in class each week. Today I am going to talk about, and Pam is going to talk about, 2 topics that we chose. One is difficult emotions. So we are assuming that a lot of people that have symptoms believe that they are due only to the symptoms or only to the disease. Of course, the health condition that we have can cause pain, it can cause shortness of breath, it can cause fatigue, etc. But it's not the only cause. Each symptom can contribute to the other symptoms, and collectively they can make it worse, and we end up being a basket case. So today Pam and I would like to demonstrate 2 activities that we actually use in class and how class interaction takes place. The first activity, dealing with difficult emotions, includes understanding and managing our symptoms. These are signals from the body that something unusual is happening, and the symptoms may include fatigue, shortness of breath, and stress. Remember, sometimes they cannot be seen by others, and some may be too difficult to describe to others. These feelings that we have are normal. They're common for people with chronic physical or mental health conditions. So, I have told you 3. pain, shortness of breath, and fatigue. What are some others problems that you associate with your health problems and your symptoms? Pam will write them on the board.
I'll give you one to start with. Frustration.
Frustration.
Our brain.
Thinking. Thinking correctly, you're like you're not in a fog.
Anxiety.
Anxieties.
You also mentioned guilt.
Great. Guilt.
Other relatives, comfortable problems. Sometimes we get
Aging
like,
problems.
Oh,
Yes, aging, normal aging problems.
aging
Insecurity or uncertainty?
Uncertainty,
That's what you're looking
yeah.
at?
Insecurity, right.
sadness.
Sadness is a good one. I have one here I didn't say. Sleep problems. Anybody have sleep problems here?
Feeling alone.
Feeling alone.
Abandoned from our kids.
Loss of family.
Anger.
Anger. Worry. Anybody worry in here with all of their problems or lack of? Okay, Pam, would you like to read those back to us?
Frustration, thinking correctly, anxiety, guilt, aging problems, uncertainty, sadness, sleep problems, feeling alone, loss of family, anger, and worry.
Okay, great list you guys did. Now we would like to take two of those problems that we would like you to determine. Two of those problems, and we will list ways to alleviate the symptoms. So, anybody have a particular one they would like to go through? Yes, you do.
Which one do you want to pick?
Loss of family.
Loss of family.
Okay.
Okay, loss of family. Which other ones that we listed?
Guilt.
Guilt.
Okay. Maybe one more.
And one, we'll do one more.
Feeling alone.
Feeling alone. Okay. What about loss of family? You know, we do live in Las Vegas. A lot of us don't have family here. What can we do if we have a loss of family?
Well, your friends, your church.
Call your friends. Church, go to church. We all have access to the internet, right? Can you do FaceTime on the internet? So you can be connected?
Some individuals have access to EAP programs, employee programs, assistance programs.
Okay. How about getting out of the house and not staying in and feeling sorry for yourself? Get out, go for a walk, or go to the mall, or go to a movie. Go visit a friend. Keep yourself busy. Don't dwell on what you don't have. Remember, this is going to be a positive. We want you to be positive.
Most of the hospitals have programs where people that have retired have YouTube.
Right. That's good. Check with your hospital for activities they may have.
And senior centers.
Senior centers are very good.
Well, MSA has it. Almost all the medical facilities have.
So there's more out there than you might think there is. And it's up to you to make a step forward.
Senior centers.
Yeah.
Oh, you got it. Thanks.
Okay, the next one, guilt. Guilt. Guilt includes you feel bad, you have a problem, you feel bad for your family, you feel bad you can't do the things you're normally used to do. What are some ways to alleviate the guilt?
I think support groups are good.
Support groups are wonderful, and we have several here at Cleveland Clinic. Church. Interaction.
Taking your class.
There you go, taking our class, yes.
I like that one.
Or just talking with someone. This is how I feel. Just getting it out in the open, not keeping it inside yourself. And then the last one is feeling alone.
Do all the above.
Do all of the above. Saves a lot of writing, doesn't it, Pam? Anything else?
Joanne brought one up about loss of family, pets.
Oh, absolutely.
That's
Yes,
Yes.
absolutely. They're a huge company, let me tell you. Okay, Pam, would you read them all?
Okay, so some solutions for loss of family would be calling friends, going to church, using the internet, EAP programs at work, getting out of the house, trying to socialize, meet people, hospitals, senior centers, have a pet. In
But
terms-
volunteering in some.
Volunteering.
Uh-huh.
Right.
Oh, that's a good one. Wow, yes. That gets you mingling with people who have similar problems or are alone like you are.
And in terms of guilt, there's support groups, church, taking our class, we like that one. Talk with someone, feeling alone. Actually, a lot of these do work for feeling alone, so that interaction, which is so important. And of course, as I think you already said, one of the most enormous benefits of our class is that you come away with lasting friendships, lasting support system of people that you can then call and be in contact with.
Or just having your girlfriend, like your BFF. Women, you know, there could be a man too, but women have a great knack for just getting together and talking it out.
Yes, they do.
Maybe guys do too.
Yes, we
I was gonna
do.
say, could I add exercise to that? Would exercise kind of help handle any of that?
Exercise helps everything,
Yeah.
our mental and our physical. That's a great one. Thanks, Verla. Now, Pam's going to pick it up with communication skills. That's the other one we're going to talk about, because if we have a problem, it's difficult to communicate either to your doctor, to your family.
And we definitely do a lot of work on communication, because healthy communication is the lifeblood of relationships. We probably already really do know that intellectually, but sometimes it's hard to get good communication skills. But relationships are the lifeline of being able to have some healthy coping skills. And poor communication is the biggest reason for poor relationships, and whether that's between spouses, between parents, children, siblings, friends, co-workers, members of the healthcare team. We work on better communication with all of those. Good communication is a necessity when you have a long-term condition. It's an absolute necessity. Keep in mind, communication is a two-way street. And there's a right way to do it, and then there's like going the wrong way on a one-way street. It doesn't work as well. So as uncomfortable as you may feel about expressing your feelings or asking for help, the chances are that the others in the situation feel the same way. And it may be up to you to open the lines of communication. So here are a couple keys to better communication. Don't make assumptions regarding others, like, oh, they should know that, because people aren't mind readers. And if you want to be sure that they know something, you have to tell them. And there's a right way to tell them and a not so right way to tell them. You can't change the communication of others, but what you can do is you can change the way that you communicate. And when the communication is difficult, it's very important to first review the situation. Exactly what's bothering you? What's bothering you about this? What are you feeling? Those are questions that we will help you to learn how to ask yourself. We're going to give you an example. Patty and I are going to do a couple of examples. Now the first one is John and Steve, or Joanne and Stephanie, however you want to be. And they agreed to go to a football game. But when John came to pick Steve up, Steve wasn't ready. And in fact, he wasn't even sure he wanted to go because he was having trouble with his arthritic knees. So the following conversation took place.
You just don't understand. If you had pain like I do, you wouldn't be so quick to criticize. You don't think of anyone but yourself.
Well, I can see that I just should go by myself. Now, in this conversation, neither John nor Steve had stopped to think about what was really bothering them and how they felt about it, and they were blaming each other. And that's very unfortunate. Now, the following is the same conversation, but with both people being a little bit more thoughtful in terms of their communication. When we make plans and then at the last minute you're not sure you can go, I feel frustrated and angry. I don't know what to do. Go without you? Stay here and change our plans? Or just not make any future plans?
Well, when my arthritis acts up at the last minute, I'm also confused. I keep hoping I can go, and so I don't call you because I don't want to disappoint you, and I really want to go. I keep hoping my knees will get better as the day wears on.
I understand.
So let's go to the game. You can let me off at the gate before parking so I won't have to walk so far. Then I can do the steps slowly and be in our seats when you arrive. I really want to go to the game with you. In the future, I will let you know sooner if I think my arthritis is acting up.
Sounds good to me. I really do like your company and knowing how I can help. It's just that being caught by surprise sometimes does make me angry. In this dialogue, John and Steve talked about the situation and how they felt about it, and neither blamed the other. But unfortunately, we get into these situations where we have a blaming conversation, a blaming communication, which just doesn't work well. Maybe we're not listening, we get caught not listening, and then we blame the other person. Even in this situation, thoughtful communication can be helpful. Now, we have another example involving Jan and Sandra.
Why do you always spoil my plans? At least you could have called. I am really tired of trying to do anything with you.
I understand. When my anxiety acts up at the last minute, I'm confused. I keep hoping I can go, and I don't call you because I don't want to disappoint you, and I really want to go, and I keep hoping I'll feel less anxious as the day wears on.
Well, I hope that in the future you will call. I don't like being caught by surprise.
I understand. If it's okay with you, let's go shopping now. If I start feeling too anxious, I'll take a break in the coffee shop with my book, and you can continue to shop. I don't want us to keep making plans, and in the future, if I'm too anxious, I'm going to let you know sooner. Now, in this example, only Sandra is using thoughtful communication. Jan, over here, continues to blame. But the outcome is still good because both people got what they wanted. So just a couple suggestions, and we talk about this a lot in class. Things we know, but we sometimes forget. Show respect. Always show respect and regard for the other person. We want to avoid demeaning or blaming comments and, like, Why do you always spoil my plans? That puts the other person on the defensive. The use of the word you is a communication that's used in a blaming conversation. Tact and courtesy go a long way diffusing situations. And be clear, describe the situation, and don't use words like always and never. For example, Sandra said, when anxiety acts up at the last minute, I'm confused. I keep hoping that I can go. And I don't call you because I don't want to disappoint you. And I really want to go. I keep hoping I'll feel better as the day wears on. Don't make assumptions. Ask for more details. Jan just assumed that Sandra was rude because she didn't call. But it would have been so much better if she'd asked Sandra why she didn't call. Assumptions are the enemy of good communications. Assumptions are the enemy of good communication. Many arguments arise from one person's expectations and expecting the other person to be a mind reader. So open up, express your feelings honestly. We work on this a lot, and accept the feelings of others. Sometimes that's really difficult to do. It's not always easy to understand your partner or the person that you're caring for. But sometimes you need to think about what was said and don't even answer right back. Give a few seconds. Pause. Maybe the other person has more to say rather than just jumping right in. There's nothing wrong with a little humor, used sparingly. And I don't mean sarcastic humor or demeaning humor, but a little good humor sometimes diffuses things and goes a long way to making communication better. And avoid the role of victim. We work very hard not to have any victims in our class after our 6-week program. And I think the two people in front can attest to that. They've taken our class. But we don't want to be a victim. We want to express our needs and our feelings so that the other person understands and accepts them. We deserve respect, whether we're the caregiver or whether we're the person with the chronic condition, and we want to become good listeners. So all of these things are part of the class. One of the very important things that we spend time on are learning how to use I messages. Not this I, but I messages, and Patty's going to talk about those.
Here are some more examples. Here comes the you message. Why are you always late? We never get anywhere on time. The I message would be, I really get upset when I'm late. It's important to me to be on time. The you message would be, I get really upset when I'm late. It's important for me to be on time. Or the you message is, there's no way you can understand how lousy I feel today. And the I message would be, I'm not feeling well today. I could really use a little help. So watch out for those hidden you messages. These are the you messages with I feel stuck in front of them. Here's another example of a you message. You always walk too fast. The hidden message here is, I feel angry when you walk too fast. The I message is, I have a hard time walking fast. So the trick to I messages is to avoid the use of the word you and instead report your personal feelings using the word I. Of course, like any new skill, crafting those I messages takes time. So one needs to start by really listening to yourself and to others. Grocery stores are a great place, by the way, to do this because there's always parents with children in there. You can listen to how they'll communicate. So we are going to do some now. I notice. I notice. How can we finish that? I notice. I want you to state just the facts. Just the facts. I notice when.
I notice that I feel upset when you do not show up on time.
Okay. So you're stating just the facts. You're not accusing that person of not showing up on time. Or I think, and then give me an opinion, state your opinion. I think we are going to have a good time.
Is that appropriate?
Sure,
I was.
we are going to have a good time.
That's why we did it.
Okay. Now, let's change the following statements into I messages. Number 1, you expect me to wait on you hand and foot.
You don't leave anything else.
How can you rephrase that? How many of us have said that at home or had it said to us? You expect me to wait on you hand and foot. What could we say? Using the I messages.
Sometimes I feel worn out for all the chores I do.
Good. Sometimes
I feel worn out.
I feel worn out with all the chores, especially the chores you give me.
Right.
Uh-oh, I used the word you in there. Okay. Oh, here, most of us know this one. Doctor, you never have enough time for me. You're always in a hurry. Now that's being accusatory to the doctor. How can we change that starting out with I?
I need more time to discuss my case.
I need more time to discuss my case with you.
Will they all often comply with that? Will they often go along with that?
We hope they do. And, you know, of course, we all know doctors are under pressure now, too, and they have to see so many an hour, but we hope they do.
If you
I
call them
have-
on the carpet in that way,
I was
it
gonna say,
doesn't
I
accuse
have a
them.
list of questions. Can you answer them for me, please?
Yes,
Would that be?
that would be great.
I'm sorry, I overtalked you, Kim. I'm sorry about that.
I have a list of questions, yeah.
I need a more complete explanation of my treatment.
Perfect. I need a better explanation of my treatment.
Okay.
Okay. Pam, do you want to do the last one? Ensuring clear communication?
Problem solving.
No? Okay.
Problem solving. Oh, what do you read?
Minimizing conflict?
No, I thought I was going on to problem solving.
Okay. So remember the I and the you, even within your own family. You know, how many of us have had teenagers that come in?
I am,
I am,
you say, remember always start with I am.
I think, I feel,
Oh, okay.
I hope, anything that's positive.
Oh, okay.
You're gonna write problem solving. Okay. One of the many topics that we work on in class is problem solving, because we all have problems on a good day, let alone days when we're trying to take care of ourselves and our loved one. And sometimes problems start just with a general sense of unease. You know how you feel uneasy about something and you're not really sure, maybe you're unhappy, but you're just not sure why. And then you start thinking about this and examining it a little bit more. And let's say that you find that you miss contact with relatives. You haven't been able to keep in contact with your relatives because you have so many problems at home. And you really want to go and see the family. You want to see the relatives. But of course now you have to think about, okay, how am I going to get there? I used to drive, but driving is a problem for me now. I can't do as well as I used to. So how am I going to get there? I'm going to have to research whether there's a train, which would be not too likely in Las Vegas. I don't even think there's a train station, but you might think, well, how can I get to the airport? And once I get there, am I going to be able to walk to the gate? And, you know, there's all kinds of things that go around and around in your head. So what we do is we have a series of steps to help you solve a problem, and it can be used for all kinds of problems. First of all, the first step is that you've got to identify the problem. You can hardly solve a problem if you don't really know what the problem is. So the first and most important step in problem solving is identifying the problem. Maybe, for example, you say, well, stairs are a problem, but it takes a little bit more effort to work through until you determine that it's not the stairs that are the problem. The real problem is you're afraid of falling when you take the stairs. So you have to identify what the real problem is. Then the second step is that we list ideas to solve the problem. And this works for lots of things, and we have wonderful feedback from the 4 years we've been teaching this class in terms of people that continue to use this after we have used it in class. So you list ideas to solve the problem. That's number 2. And then number 3, after you've made a list of ideas about how to solve your problem, is you're going to pick one. You pick an idea that you're going to try. Now, that idea might work very nicely and your problem is solved. You pick the idea, you check the results, you find out it's good, and it's solved. But sometimes what you pick doesn't solve the problem. So you have to pick another idea. You pick another idea if the first one doesn't work. And if that doesn't work, you utilize outside resources. That can be anything from reference books in a library to calling a friend, to calling a healthcare provider, to calling another family member. You utilize outside resources. And the final step, and oftentimes just as difficult as identifying the problem, is that sometimes we have to accept the fact that the problem just can't be solved right now. And that's tough for most of us. But once we learn how to go through this exercise and do this with a number of things, you'll come to kind of a peaceful place that will say, yeah, that's right, I can't solve it right now. And that in and of itself is really a decision. It just can't be solved right now. And you'll be able to let it go then. But problem solving is a very big part of our class, and it's very important, because trying to solve problems in uncertain times is probably one of the most difficult things that we would ever have to do. So that, again, these are examples of all the things that we do in class. Now, Patty is going to show you how we do a mind-body connection that should relax you and let you feel very good after we're finished with it. You want me to turn off the lights?
Sure. We can turn off the lights, can't we? Or not?
There's a switch right there.
Oh, there you go. Okay, this is what I want you to do. Do this with your shoulders. Sit up straight, get the kinks out and the stress out. Close your eyes. I'm going to give you a few seconds to quiet your mind, quiet your body. Allow yourself to settle comfortably. If you wish, you can close your eyes. Breathe deeply through your nose, expanding your tummy and filling your lungs. Purse your lips like you're going to give somebody a kiss. Inhale. And then exhale through your mind slowly, allowing your body to sink heavily into the surface beneath you. And once again, breathe in through your nose and all the way down to your tummy, and then breathe out slowly through your lips. Let go of tension. Let go of anything that's on your mind right now, and just allowing yourself to be present in the moment. Imagine yourself walking along a peaceful old country road. The sun is gently warming your back. The birds are singing. The air is calm and fragrant. With no need to hurry, you notice your walking is more relaxed and easy. As you walk along in this way, taking in your surroundings, you come across an old gate. It looks inviting, and you decide to take the path through the gate. The gate creaks as you open it and you walk through. You find yourself in an old, overgrown garden. A lot of flowers. Vines climbing over a fallen tree. Soft green wild grasses. Shade trees. You notice yourself breathing deeply, smelling the flowers, listening to the birds and insects. You feel a gentle breeze cool against your skin. All of your senses are alive and responding with pleasure to this beautiful time and place. When you're ready to move on, you slowly and leisurely follow the path out behind the garden, eventually coming to a more wooded area. As you enter this area, your eyes find the trees and plant life restful. The sun is filtering through the leaves, and the air feels mild and a little bit cooler. You savor the fragrance of trees and earth, and gradually become aware of the sign of a nearby stream trickling over the rocks. Pausing, you allow yourself to take in the sights and sounds, breathing in the cool and fragrant air against several times. And with each breath, you notice how refreshed you're feeling. Continuing along the path for a while, you come to the stream. It's clear and clean as it flows and tumbles over the rocks and some fallen logs. You follow the path easily along the creek for a way, and after a while, you come out into a sunlit clearing where you discover a small waterfall emptying into a quiet pool of water. You find a comfortable place to sit for a while, a perfect niche where you can feel completely refreshed. You feel good as you allow yourself to just enjoy the warmth and solitude of this peaceful place. After a while, you become aware that it's time to return. You arise and walk back down the path in a relaxed and comfortable way, through the cool and fragrant trees, out in the sun-drenched, overgrown garden. One last smell of the flowers and out the creaky gate. You leave this country retreat for now and return down the road. You notice that you feel calm and you feel rested. You feel grateful. And remind yourself that you can visit this place whenever you choose to, whenever you wish to take some time to refresh yourself and renew your energy. And now, preparing to bring this period of relaxation to a close, you may want to take a moment to picture yourself carrying this experience of calm and refreshment with you into the ordinary activities of your life. And when you're ready, take a nice deep breath and open your eyes. Some of you might have fallen asleep on us. Almost. Thank you for having us today.